Welcome everyone, and thank you for coming to Clinician Conversations. Today we have Natasha Watkinson with us today. She is a OWL Perks provider, and she's also an alum. Everyone, welcome.
Thank you, Irene. I really appreciate it so much. I appreciate you and all the help that you have given me, and you've been so gracious and lovely to work with. So thank you so much. And whoever is watching this and is responsible for giving you extra credit or, extra perks, they should. I also just want to say how honored I am to be doing this for FAU. I'm a proud alumnus, and just, to be able to just give back in some small way is meaningful, and especially in the area of mental health, which I think is so important and necessary, and nothing that we should all not talk about. It's something we should definitely be speaking more about and having more conversations about. So it's an honor to be a part of that conversation.
Thank you.
I thought I would start out by just describing what the letters that you see underneath my name mean. I think that is something that not a lot of people really talk about and pay attention to, but anyone who works in the field of mental health, and that meaning, a psychiatrist, psychologist, social workers, marriage and family therapist, or mental health counselor, we all essentially are doing more or less of the same work. A psychiatrist is obviously a medical doctor, and they're prescribing medication and working in different settings than we are. But, at some point, some of them were and continue to engage in talk therapy. A psychologist would be engaging more in assessments and diagnostic work, but also doing talk therapy. And, social workers, marriage and family therapists, our scope of practice may come from a different sort of perspective or, college that we graduate from. But at the end of the day, we're all on some level doing the work of psychotherapy. So what you see under my name is LMHC, which means that I'm a licensed mental health counselor. I'm licensed in the state of Florida. We have got to be licensed in the state that we practice, and not necessarily that we live in, but we can't see people from anywhere, in the United States unless we are licensed in that state. So I am licensed only in the state of Florida, which means I can only see people who are residents of the state of Florida. I can, there's flexibility within that to some degree, but that's what that means. If you don't see that under someone's name, if you don't see that L, whether it's LMHC, LMFT, LCSW, and I'm sorry, but at the top of my head, I don't remember for psychologists and psychiatrists, but they are also licensed and would definitely be registered with the Department of Health like we are. Be careful, that is not someone who's following the scope of practice and following the rules and laws of the field. So that's really not someone I would encourage anyone to work with. That's not to say that life coaches, healers, there are myriad healing practitioners out there that all can do excellent work. I'm not saying that's not true, but unless you are a licensed practitioner, it is unclear to what ethical and, laws you follow. And so that's really an important part of every 2 years we have to get relicensed and demonstrate competency with the state. The NCC means that I'm a nationally certified counselor with the National Board of Certified Counselors, NBCC, and that's a national organization. They are an important, governing board in our field, and they work to advocate for mental health, and they administer the exams. They're quite involved in the scope of practice of counselors. And then the M.Ed, although some people think I'm a doctor, that is not what that means. It means that I got my master's degree from the College of Education at FAU. So we can just move on to the next slide. If you want to know more about me, go on the internet. It's not, I'm not that interesting. So what I want to say about this slide is that it just made me laugh so much when I saw it. Because I think that is one of the misconceptions. There are many, but I think that is definitely one of the misconceptions of therapy, which is that you just go in and you talk about your problems. and you're venting, or you're just kind of paying someone to listen to you. And the reality is mental health care is about talking, but it's also about so much more. And it's about learning new skills, but it is also about unlearning thoughts and beliefs and behaviors and attitudes that we have learned, and taken into our psyches and have transformed us into people who maybe engage in behaviors or think in ways that are unhelpful or have difficulty in relationships. And so I just like to sort of remind people that sometimes becoming a healthier person is about unlearning as well as learning. And that is often a process that people need objective professional support to be able to accomplish.
Nice. So may I ask, would you
Of
say
course.
that we need to unlearn more things than we do need to learn, or is it equal?
It really depends on the person. We all have our unique experiences. Being a human being is not that unique an experience, at the end of the day. But in terms of nature versus nurture, the family you grew up in, the traumas you've experienced, the socioeconomic status of your community, there's a sort of macro and micro when it comes to mental health. So that is what we're sort of assessing, and trying to understand in those first few sessions is what makes you think this way? What has created this addiction? What is contributing to this belief you have, or the reason you're in this relationship that's not good for you? You're a part of that, and understanding your part in that is often where the unlearning comes. Unlearning, for example, that you are good enough, that you do deserve the good things that are happening for you. That is a common one, just the fundamental belief that, like, I'm not good enough. And where does that come from? And how did that become part of what you think about yourself? That's the sort of part I'm talking about in terms of really challenging those beliefs, and those thoughts, and recognizing that you can have alternative thoughts, not alternative facts, but alternative thoughts.
Nice. Thank you.
Does that make sense?
That does. It does.
Yeah. Yeah. And then we build on the skills from there, but often the unlearning comes before the learning. Yeah. So this is I think a nice infographic. I am not going to read it out. I hate when people read out slides from a PowerPoint. So we're not going to be doing much of that today, but I do just want to recognize the very much is and isn't side of this, that there are a lot of misconceptions in our culture, even on, I hear it in people who should know better, speak in terms like saying things like crazy and OCD and bipolar and schizophrenic. And, people throw these terms out without really knowing what they're talking about or even accurately describing what they're, making a reference to. So that's a problem, in that we're very casual and sort of flippant about what mental health is. And I think culturally, this is, again, dependent on many factors, but there is this overriding thought in cultures that it's a sign of weakness, that it's attention seeking, or that, we just have to focus on the positive, and, that we just have to decide, to not be sad, for example. What I'd like to just stress on the is side, on what mental health actually is where it says on a continuum. That is really important in terms of what we're going to talk about today, and just in terms of thinking about your own mental health. There is the bell curve, which we're all familiar with, and if you think about like intelligence, you'd have your, low IQ and your very high IQ as outliers. And then most people falling somewhere in the middle, that's your traditional bell curve. Mental health, as we think of it now in the Diagnostic and Statistical Manual 5th edition that we work out of currently, is thought of more as a spectrum of severity. So all of us fall somewhere on that spectrum. All of us can be sad. All of us can have conflict. All of us can have certain narcissistic aspects of our personality, but it doesn't mean we meet the full criteria for a disorder or a mental illness. And that I really want to stress, is to think about everything that we're going to talk about, or anything that you're thinking about after we have this talk, or, you know, in your own friend group or family, or for yourself. How severe, how often, how frequent? Those are the questions that are really helpful in getting a diagnosis that's accurate. And, you know, today we're going to talk about mostly mood disorders, anxiety disorders, and a little bit about personality disorders. But, you know, the developmental disorders like autism, I think are the people where people are the most familiar with this idea of a spectrum, you know, that people can sort of be high functioning, low functioning. That I think is really helpful just to keep in mind that that's true for most mental health issues.
Right. And can I add, when it comes
Yeah.
to what mental health isn't, I feel like it's
Yeah.
often that college students see it as like they themselves, for example, I don't think mental health is something that's shameful or it's a sign of weakness, or that it should be stigmatized. But in that same breath, I'll think that other students may see it as something shameful. So I shy away from talking about mental health with other people, because although I don't think it's a problem, I feel other people might. And so I think we may need to have more open dialogues when it comes to mental health, because we may all realize that we all don't believe it to be shameful, or we all don't really see it as a sign of weakness, and that getting therapy is not something that you should be ashamed of or anything of that sort.
Yes, a very good point, and a necessary one. And I think, going back to something I was saying earlier, part of what I think contributes to that is this casual way that we talk about anxiety or mental health, you know, OCD, or any sort of something that maybe you haven't even had a diagnosis for. You know, you don't actually even know if that's what's wrong or what's going on with you, but people are talking about my anxiety as if it's this, you know, thing, you know, that exists for them in their life. And the reality is anxiety is part of being human. You know, everybody has anxiety. Do you have an anxiety disorder? You know, that's a different question. And so part of what I think needs to change is that we're having more informed, factual, insightful conversations about mental health, rather than either just dismissing it, or, you know, acting as if it's not even or therapy isn't real. I hear people say, I don't believe in therapy, like it's Santa Claus, you know. But, you know, we're either having that conversation, so of course people are going to not want to share how they feel with someone who thinks like that. But at the same time, you have people who talk about themselves as if they're so damaged and so something is so wrong with them, you know, because they have anxiety or because they have ADHD and they need to take a medication for that. And the reality is that's really, you know, just basic stuff. Like, that's fine, you know, that's just brain chemistry and figuring out, you know, how to get yourself into balance. And anxiety is a human necessity in order to, it keeps us safe. So we just, what we really should be saying is things like, I have a hard time controlling my anxiety, or I experience severe social anxiety. You know, to have a more informed and educated conversation around mental health, I think would help that a lot, you know, in terms of just feeling more comfortable in engaging in vulnerable conversations, you know, because you just don't quite know where someone's coming from when you might want to share something like that.
Right.
Yeah. Yeah. I see what you're saying there. Yeah. And we're really good at like putting the Instagram posts on, and, you know, no, it's okay. We can go to the next slide, but just to say, like, I think what you're saying too is that we can put the stuff on Instagram and Facebook and give a lot of, like, you know, superficial acknowledgement of that mental health is important. But if we're not practicing that in our own life, and not, you know, and, you know, listen, professionals are guilty of that too. You know, you can be an expert in a field and still engage in behavior that's not, that maybe you wouldn't be telling your patients, you know what I mean? Like, that's good. You know, like, there are a lot of doctors who used to smoke, for example, you know, like, we're all on some level guilty of not being, you know, 100% all the time. But yeah, a lot of people say they think mental health is important, but don't live like that's true for them on a day-to-day basis. Yeah, I agree with that. You know, these numbers are real. They are based in science and fact, and you can find them. You know, if you did a Google search on a Google Scholar, you can find these studies and look more at these numbers, but I just wanted to mention those before we get into any others. Speaking of facts and opinions, this was a very alarming statistic. Less than 14% of 15-year-olds can distinguish a fact from an opinion. And that's in America. And that is not just in America, that is all over the world. Those numbers are pretty low. But at the core of being able to make informed and meaningful decisions is the ability to understand what is a fact and what is an opinion. And we're clearly not doing a good job of teaching that to people, you know, to young people. So it's really important, especially as you're listening to this and you're hearing me talk, there will be citings. I will cite my sources, as you see here, but I will also be offering my professional opinion. And I'd like people listening to understand the difference between those two things. It's very important that we hear a lot of opinions, especially on social media, but those are not always based in fact. So we have to sort of really ground ourselves in what is factual, what is observable. And when we're thinking about our own mental health, that's also important too, you know, because day to day we feel differently, and we have to look at what the research says, what the criteria is for certain diagnoses before we start describing ourselves as depressed or anxious or bipolar. Okay. One thing I've seen a huge increase in just my own private practice is eating disorders in the past year. Correlation, you know, does not always imply causation, but I don't think that it is a coincidence that because we've been spending more time online looking at ourselves, you know, video conferencing and online schooling, I think it is a big reason as to why people are more self-conscious, more aware of what they look like. And I think boredom probably contributes to some of the binge eating disorders that we're seeing. So, you know, this is, again, a statistic that is not of this past year. So that's not a great number to start with, that every 62 minutes, a person dies from an eating disorder. That is only getting worse in this time. So it's something to be very aware of. And if you think someone you know is struggling with an eating disorder, you know, that is not something to celebrate. That's not something to go on TikTok and talk about and you know, compare how much, you know, weight you've lost or how little you're eating. I mean, this is very disordered behavior, and we need to treat it very seriously because people are dying. And then social media, you know, I'm not telling anybody to get off social media. I would never do that. Nobody wants to hear that from anybody. But I think if anyone's watched The Social Dilemma on Netflix, if you haven't, you should. And I think that we have to at least understand that teens who use social media were 70% more likely to have suicidal thoughts. And the more social media you use, the higher rates of anxiety, depression, social anxiety. Just comparing yourself is such an unhealthy behavior to engage in. And it definitely has, you know, 2010, some of the statistics that I was just citing, you know, in 2007, 23% of college students said they were depressed. In 2018, 41%. The only thing that changed in our society was social media. You know, 2007 is about when Facebook started. So we can't deny the impact of that. And we just have to be mindful of how we're engaging with social media, because the effects are pretty clear. Okay, we can go to the next one. So this first part of the presentation is about sort of the causes of mental health issues, you know, and drugs and alcohol are often the cause and the effect. I like this meme so much. I think it sums up really the whole essence of drugs and alcohol. You know, it is the cause and the solution to our problems. You know, you're having a bad day, you're stressed, you smoke, you drink, you feel better. And this is not a coincidence. Alcohol is one of the most effective ways to deal with social anxiety. It lowers our inhibitions. It makes us feel more relaxed. I think if anyone's seen another show on Netflix, clearly I watch a lot of Netflix, but if anyone's seen The Midnight Gospel, the episode with Mr. President, who is the voice of Dr. Drew Pinsky, who's an excellent doctor and works a lot in the area of addiction. But, you know, his point was really well made in that there are no bad drugs. You know, you will go into hospital for a surgery and get the purest form of heroin available, but you don't walk out of hospital addicted to heroin. If you walk out of hospital with 100 Percocets in your pocket, you're going to get addicted to heroin, you know? And so it's the context in which drugs and alcohol are used that really is the point here. Alcohol is not a problem depending on the context in which you're drinking alcohol, you know? There's amazing research coming out of Johns Hopkins and other areas now, other universities, and now the state of Oregon can conduct their own research in, you know, a variety of ways. But psilocybin, LSD, magic mushrooms can be an incredible tool for helping people, you know, in terms of getting over various depression, anxiety, addiction. But, you know, a couple friends in a dorm room tripping their faces off, you're not going to have a transformative experience from that. You know, if anything, it's going to lead to more issues of anxiety, of depression. That's just such a strong drug, and we have to be so careful. So again, it's context. That's the issue. It's not the drug or drink, you know, necessarily that's the problem. Two examples of this that thank you for. I'm going to do alcohol maze first, Irene. Irene, did you have anything to say? Like, did you want to add anything or ask any questions at this point before I move forward?
I would probably just mention that being a part of the honors college at, you know, FAU, I feel like we put a lot of pressure on ourselves, and that at times leads us to result to like using certain substances as sort of self-medicating and helping ourselves in that way. And so I definitely appreciate you mentioning this part, like just talking about how some people may say just don't do that, but that's not a very realistic outlook on how things really are. So just being mindful of how we go about it, I think that would be something that I would just mention. I like how you put that.
Thanks. Yeah, I mean, that's the, you know, here I am drinking coffee, you know, I don't, again, correlation is not causation, but as people stopped smoking cigarettes, anxiety medications increased. You know, people have always turned to some form of relief, and we're not going to stop doing that. But it's the use, you know, it's does it serve your needs, or is it the sort of, I think it was Winston Churchill that said about alcohol, it should be your servant, not your master, you know? So these things can serve a purpose, but when we start abusing them and when we start, when they start to take control, you know, and our whole day is centered around when we can start to smoke or when we can take a pill or whatever it is, we've got a problem, you know, and often these are really good examples of why we have those issues. So you don't necessarily have to bring up the research study, but they're both cited there. I'm going to talk about alcohol maze first.
Okay, I'll definitely share that, no problem.
Okay, so alcohol maze was a study done where a control group of rats and a test group had to learn the same maze. You know, they both had to complete a maze. You know, there was a beginning and an end. One group was sober, one group was drunk. And at the end of that, you know, session, they both could complete the maze. The next day they brought them back and both groups were sober. Now the group that had been sober the night before remembered the maze and could complete it. The group that had been drunk the night before had no idea. They couldn't complete the maze, even though they had completed it the night before. And I think this is, to me, one of those examples of why people get so stuck in their addiction. You know, and maybe you have examples within your own family or friends of, you know, maybe there's somebody in their 50s or in their 40s and they're like, they've never grown up, you know, they've never kind of, they're so stuck. And the reason for that is that when you're under the influence of drugs and alcohol, you can appear like you're functioning pretty well, but you're actually not really applying new information. You're only sort of working off of what you already know. So you're not really taking in and applying new information, and it often leads to people being very stuck in a certain time of their life, you know, people who just never quite grow up or never quite move on. You know, often drugs and alcohol are the reason for that. Right. You know, they're just cognitively impairing people. The other example is the rat park. And in Rat Park, what they did was they had water bottles with cocaine in them. And in one cage, it was just a rat and his water bottle. That was it. And that rat was hitting that water bottle all day. In the other cage, the rat had a water bottle with the same amount of cocaine in it, but he also had toys and food and games and exercise and other rats. And that rat barely touched his water bottle. And Rat Park, to me, is the key to treating addiction and to understanding why addiction starts in many ways. You know, there's a lot of conversations around that addiction is genetic or that it's an allergy or an illness. And while I don't dispute any of that, I think what Rat Park shows us is that it's often about stimulation or lack thereof. And you'll see it in animals, you know, if you have a dog or a horse, or you see, you know, an animal that lacks stimulation is going to start biting their own fur, start, you know, biting your shoes, start causing trouble, and start, you know, almost self-harming because they're not stimulated. And we as humans do that as well. You know, either we're doing it within our own brains and we're overthinking and we're, you know, creating a sort of anxious state within ourselves. And then often that leads to unhealthy behaviors. So having said that, we can go to the next slide, because the key here then is, where is your Rat Park? How do you create a Rat Park for yourself so that you are stimulated and able to not have to turn to things like drugs and alcohol because you're bored and lacking stimulation? And that's often a big reason why people do. So Irene, where would you recommend people at FAU turn to find their own Rat Park? And again, this looks different for everybody. Some people are extroverts and require a lot of other rats in their park, and some people just want one or two. But what would you recommend as far as resources that are available to people?
Right. And so what I would say is that if you're looking for events going on campus just to be involved with, or even clubs, organizations you want to join, the FAU Campus Life newsletter is a great resource. I can go ahead. They share that on their Instagram, and they also send out newsletters through email. And I think that's a really great resource. There's Program Board, which are also always hosting events that are going on. And then there's also COSO. So COSO has actually an event going on later today, and we have a representative here just to talk a bit about that.
Great.
Hi, can you guys hear me?
Yes.
Yes, right. Okay, my camera's working. I just want to make sure. So hi guys, my name is Hiba Hussein, and I'm one of the COSO assistants here at the Jupiter campus. So I just wanted to give you guys a little bit more information about what COSO is and like what we stand for. So COSO is a branch under the student government here at the Jupiter campus, and we stand for Council of Student Organizations. So we actually have 30 student-run organizations here on campus. So if there isn't a club already here for you, it's super easy to make one. And it's really fun because it just brings a sense of community here on campus. So we have a bunch of events that we usually host throughout the year. And if you guys have been here in past years, we've had like the Carnival, which is like a carnival that comes to campus, which is super fun. We've had different like Halloween themed balls that have happened in the past, but obviously because of COVID, we've had to put those aside and we can't really do them right now. But we did just have our in-person Club Fest, which took place yesterday, where all the different clubs were tabling. So if you didn't get a chance to go and take a look at the clubs there, we're having a virtual component of the event tonight. And that's going to be happening from 4 to 6. So yeah, perfect. Thank you, Irene. Yeah, so we're doing this over Zoom, and you can come see the different clubs on campus and just register for them. So yeah, I highly recommend going out to this event and getting more involved on campus. So yeah, thank you so much.
Thank you so much, Hiba. We really appreciate you talking a bit more about COSO and what you guys stand for and what you all do. Just to hype that up again, make sure you go to the virtual Spring Club Fest if you're interested to see just exactly what various clubs and organizations are on campus to see what really fits for you, what really suits you, and what you could be involved in moving forward. Thank you.
But yeah, thank you.
Right on. And so we can go ahead and talk.
Okay.
Mm-hmm.
Great. That was so helpful. Yeah, I love that's even going on just like right after this. So perfect. That's really a great step in the right direction. And yeah, I mean, just having fun, just joining any kind of group, whether it's a kickball team or, a networking if you're more focused on your career. But this idea of Rat Park is what I'd like people to remember, is that this is what we need in our life. We need activities, we need stimulation. If you're staying in your room all day and not meeting people and not seeing people and not getting outside, are you going to feel depressed? Yes, you will absolutely feel depressed. Does that mean that you have depression? Not necessarily. So let's go to the next slide. And are there any questions at this point? And if not, that's great. We can just move on. But if there are, I think we can definitely answer some.
Currently don't see any questions, so we can go ahead and.
So let's move on. So we're going to get into now the part where we're going to start defining some of the mental health diagnoses that are more common. In the diagnostic and statistical manual that we use to diagnose patients, and that is something that licensed clinical professionals use, that's our tool, that's our manual, and that lists every disorder that currently is, approved by the American Psychiatric Association. And within that, there are different categories of illness, of mental illness. So you would have things like your cognitive disorders, which would include cognitive decline issues like dementia or Parkinson's. You would have your developmental disorders, which would be, issues starting really from birth. Things like autism would be a developmental disorder. And then we get into personality disorders, psychotic disorders, mood disorders, and anxiety disorders. So those are the categories. Within those come the different diagnoses, the different variations of that. So we're just going to touch on a few of those today. I'm not going to discuss developmental or cognitive disorders. They don't really apply to this conversation. But if you do think about autism, that's kind of where this idea of a spectrum comes from. And, autism can be severe or mild. And in the newest edition, in the 5th edition of the DSM, that is where all of our focus has been put, is to think of everything that exists in terms of mental illness on that spectrum of severity. Okay, so when we think about depression, like poor Jessie, from Big Mouth with her depression kitty, that feeling of hopelessness and sadness and lethargy and just, not really wanting to do anything, not feeling motivated, suicidal thoughts can occur. What you want to understand is that it is normal to feel sad. That is a human feeling. It is one of the 5 primary feelings, sadness, anger, fear, disgust, and joy. We experience that because we're human. Being sad, again, does not mean that you're depressed, but if you look at the severity, if you look at the frequency, if you look at the duration, that is the indicator. So if you've been feeling sad and hopeless and having suicidal thoughts every day, all day, for more than 2 weeks, then it's time to go and get an assessment for depression and to ask for help. Feeling sad or kind of lazy, every now and then doesn't equal depression. It just means that you're a human experiencing the full range of your feelings. So I'd really like people to keep that in mind. Severity, frequency, and duration is really what we need to understand to help you understand what's going on with you. In terms of a personality disorder, Lola here is a really good example of someone with a personality disorder. She would probably be diagnosed with something like a borderline personality disorder. There are several, and they're clustered into 3 different categories. But people with a personality disorder experience, in terms of a spectrum, a severe problem with interpersonal relationships. They're rigid and have a very, very unhealthy pattern of communication. These are people who often have a lot of drama in their life, a lot of conflict, lack empathy, are very dependent, are very histrionic, you know, in their presentation, very attention seeking. And I'm saying very because that's what we're talking, right? Very. Everybody's got a little bit of that, you know, in some varying degrees. But it's, again, about the severity of that that really helps us understand in terms of if that's diagnosable. Okay. So to the next one, anxiety disorders show up in 4 different categories. So anxiety has its roots either in the fear of a negative evaluation. So that's your social anxiety. People are going to think I'm, you know, again, a big mouth reference, the little mosquito, the Tito, the anxiety mosquito is in your ear saying, nobody likes you. Everybody thinks you're stupid. You look ugly. That's that anxiety. Catastrophe is the catastrophizing. Something terrible is going to happen. Always assuming the worst, you know, fearing that the worst outcome is most likely. The uncertainty aspect, which we've all been dealing with, you know, in varying degrees, that's another way that anxiety can show up when we just have, you know, no sense of what is going to happen next. And then the fear of losing control is often, you know, underneath the panic attacks that people experience. OCD would kind of be part of needing to control, you know, needing to feel a certain sense of control over ourselves. So various diagnoses exist within the anxiety disorders, but they all are connected to one of these 4 areas of you know, triggering aspects of that. So the thoughts that accompany that are the catastrophizing, jumping to conclusions, you know, filtering good information and only looking at the bad. This is often what that mosquito is saying to us. You know, it's that, you know, something bad is going to happen, you know, jumping to conclusions. This is the thought that then will either proceed or follow the anxious feelings. And often, you know, it's kind of a cycle. You know, when you start thinking people are judging you, that leads you to feeling anxious, but then you're anxious, you know, because you're afraid. So it's kind of a difficult cycle to get out of. But one of the ways we do that is by challenging these thinking styles. Any questions yet, Irene?
I'm not sure about any questions, but I would like to add that what I've noticed amongst high achieving students desiring to be like not necessarily the best of the best, but sometimes the best of the best is this high functioning anxiety, right? Where we are still going about our day, we're still doing what we do, but you still have these, like, you still have anxieties as you go about things, right? Because you want to do really, really well. And as a result of really, really wanting to do well and being accepted, you end up having these trends that coincide with high functioning anxiety. So that's something that I noticed, especially amongst me and my friend group.
Would you say that which of the 4 do you feel that's connected to?
Just probably uncertainty and loss of control, because you're uncertain on like I'm doing well, but how well am I doing? And then the loss of control, probably just wanting to feel like you've got stuff together, right? It's just trying to manage all the things that you're doing and feeling like you can't always do that.
Yeah, that's so helpful. Thank you so much. I would also add that there is that fear of negative evaluation aspect to it as well. You know, the negative grade, the negative review, you know, the negative feedback. That can be very motivating. And thank you for saying that, because I think I don't want to overlook the fact that anxiety keeps us alive. Anxiety is part of our sympathetic nervous system. It's part of what alerts us that you're in danger, you know, be careful. Anxiety is not something we want to get rid of. We want to manage it better. We want to get it under control. We want to recognize that many of us have no fear of being eaten by a bear. And so we don't, you know, our brain doesn't distinguish a bear from a presentation. You know, we just experience anxiety. Our body recognizes that we're not breathing deeply, you know, our cortisol starts flooding and our body just goes, oh, there must be a bear, you know? And so this comes from a very deep place in our brain. You know, this comes from our caveman brain, our cavewoman brain. So this is really not something that we want to get rid of because it keeps us healthy and keeps us alive, and has for many, you know, in many various, you know, ways that I could get into, but, you know, I won't, but, you know, it has served people very well. You know, anxiety is what keeps you trying to achieve and driving you forward and being effective. Some of the most effective people are the most anxious people. And we don't want to take that away from people, but we do want to help people manage that better, because it's not good for our systems, our nervous systems, to be constantly flooded with cortisol and the stress hormones. That's just not good. And we were never designed to experience anxiety like that.
Nice. Thank you.
Okay, so moving on to just some terms I'd like to get into. Obviously people can read this, but the main one here is psychosis, because the psychotic disorders are the more severe mental illnesses. And that would be your bipolar disorder, which is a mood disorder, but when psychosis is present, you know, it's very severe. And that's your bipolar 1 disorder, okay? Schizophrenia, for example, would be a psychotic disorder. So I really just want to describe that. The others are also symptoms of signs that someone is going through a mental health crisis. But psychosis is really the one where you're hearing, seeing, or believing things that are not based in reality. And when someone has experienced psychosis, you can't, as their friend or family member, tell them that they're wrong. You know, if they see a bird, they see a bird. You know, their brain is going through a chemical experience that is informing them that they really are seeing a bird. There's no bird in front of them, but you can't really tell them that in the moment. But it is important to be aware of they're going through a psychotic episode and they need medical attention immediately. Mania, elevated energy, intensified mood, delusions of grandeur, you know, people who all of a sudden just feel superior to everybody else in a way. You know, they think they're Jesus, they think they're a God, they're a Messiah, you know, this is a very extreme form of a narcissistic symptom. Psychomotor agitation, you know, people who are just sort of not even realizing that they're tapping their feet or fidgeting in a very extreme way. So I listed this. Sad Girls Club is a great Instagram account. If you don't follow them, I think, you know, they're definitely one to follow. This is also on my Instagram page if anyone would like to refer to it. So I'm not going to get into any more of those definitions, but I do think in terms of understanding yourself and others, these are things that people definitely need to pay attention to, because when we see this, we're heading into a much more severe part of that spectrum. And we need medical attention for someone who's experiencing any of these symptoms. Okay, so if there are no questions, that's fine. We can just move on to some of the ways to help and to get support.
Right, so I'm trying to open my chat box and I can't quite open it. So just in case, if there are any questions that have been asked, I may not have seen them. So you're welcome to raise your hand and, you know, I can unmute you, you can unmute and ask, but otherwise we can just go ahead and move forward. No
and there'll be time at the end too. So if, you know, if we can, I'll definitely make time. And if people would rather not ask a question, I totally get it. You can always, you know, ask a question to Irene and she can pass it on to me, and I'm happy to answer after the presentation as well. Okay, so now we're heading into the last part of this presentation, which is about how do we take care of ourselves? You know, what do we do with this? Okay, we've got anxiety that's, you know, out of control, or, you know, it's getting in the way of us feeling good on a day-to-day basis, or we've been feeling sad for a few days and it's not going away. Well, sometimes we need to look at what are we doing, you know, day to day, on a day-to-day basis, what kinds of things are we engaging in? Because sometimes, as I remember I think is it Occam's razor? You know, sometimes the simplest answer is the right answer. You know? Sometimes you're not depressed, you're just dehydrated. You know, sometimes you just need to get outside and get some fresh air. You're not anxious. You're just been inside playing video games for too long. So things like having a creative outlet, getting enough sleep, eating healthy food, eating regularly, having a sense of humor, laughing about yourself, you know, and with other people. No one should ever dismiss that these are very simple things that people should be doing every day, and they have a huge impact in terms of overall mental health. You know, that's not to say that people don't engage in all of these. You know, people can engage in all of these and still have a mental health issue, but we definitely want to rule out, you know, you could be dehydrated, you could be malnourished, you could just be suffering from sleep deprivation. You do not have a mental health issue. So this is another, you know, great meme, but definitely captures what people need to incorporate into their daily routine. And if people are not meditating and engaging in some kind of exercise, then you are not taking care of your mental health. You know, and if you are not eating well, if you are not sleeping well, your mental health is going to suffer. If you are not getting outside and engaging in just some kind of, you know, breathing, you know, of fresh air, and you know, we live luckily in an area where we get sun all year round, but you know, never diminish or undervalue the importance of these in terms of self-care. You know, another term that gets thrown around a lot, self-care. So, you know, self-care is not just taking a bubble bath. Self-care is practicing daily, you know, a routine that is in service of your health. Okay, so moving on to the next slide. If you're doing all of those things, all right, you're exercising, you're eating well, you're getting sleep, but you're still experiencing difficulty with anger or sadness, or you're perseverating over something that you just can't, you know, shake. You just can't get rid of this thing that happened, and you can't kind of, you know, you have feelings around that. This is what we mean by mindfulness. This 6-step approach is really what mindfulness means. You know, at the end of the day, it's another term that gets used a lot and doesn't really get defined. But mindfulness is the opposite of avoidance. You know, mindfulness is turning towards your feelings, turning towards what's going on, and sitting with it. Being able to inquire and investigate without judgment, but to be able to look at your feelings or what's going on and not turning away from it, not trying to escape by drugs or alcohol or gambling or shopping or sex or food, or, you know, just people who've got a lot of drama going on in their lives. People are wonderful in avoiding their feelings, but the reality is it doesn't help. You know, you just end up where you started. Mindfulness is an amazing tool to just be able to sit with discomfort. And one of the words that I've heard more in the past few years than ever before is awkward. Oh my goodness. To avoid anything that is awkward seems to be very important to young people. And I'm sorry that I have to be the one to tell you that life is full of awkward. And to be able to just deal with that, you know, to sit with that, to look at that, and to confront that is incredibly powerful. And it is one of the tools that will help you immensely in your life. Now, that's mindfulness. Some basic strategies I'd like to talk about are the idea of, again, the idea of a spectrum is really important. You know, not a bell curve, not like, you know, the outliers of low IQ, high IQ, and we're somewhere in the middle. No, this is really a straight line of severity, you know, 0 to 100. And if you think about depression and anxiety, I want us to think about balance. I want us to think about that line going up and down. So when we're depressed, we have not enough energy. And when we're anxious, we have too much. And so the way to combat that is to balance it out. So if you're experiencing symptoms of depression, go and engage in something that's going to increase your energy. Go dance around your room, go for a walk, go for a run, you know, go for a swim. But increasing your energy is the way to balance that. If you're experiencing anxiety, engage in things like meditation, a gentle yoga practice, sitting in the park outside and just being still, these are the ways that we can balance that energy. And exercise especially is so important in terms of helping us. Exercise is sort of nature's Prozac. And especially even for anxiety, I have to say, anxiety can show up for us as in various ways. What the two that people are most familiar with is fight or flight. So we either become very agitated or we just want to get out, we just want to run away. That's your flight, and then if you're experiencing like a anxious aggression, where you're angry and you're irritated, to engage in an exercise like softball or tennis or a punching bag is giving your body what it needs. I want to fight. Okay, so hit something, The flight response, wanting to run away, again, go for a run, go for a walk, go swimming. You're giving your body what it's saying. I want to run away. Great, go run. And so what you're doing is giving your body what it's asking for, and then the body goes back into balance. The brain, the body, it's all connected. But giving ourselves what we are missing, balancing, is really so critical in terms of taking care of ourselves. So if exercise is nature's Prozac, orgasms are nature's Xanax. They are very effective in helping us reduce anxiety and creating a sense of, calm and well-being. So whether by ourselves or safely with another person, they're really a very important part of what it means to be alive and healthy. Again, meditation is very important. I'm going to skip alternate nostril because I'll actually demonstrate that, but where's my putty? Here's my putty. I keep it in my desk at all times, and I use it. It's got, it's not like slime. It's got some kind of tension to it, but I find that really helpful when I'm fidgety and getting, a bit anxious. And so anything like that can really help, in moments of anxiety. Do we have time for me to quickly show this? We've only got a few slides left.
Yeah, I think we have enough time.
Okay, it's a pretty quick demonstration. I usually teach most of my patients this, but alternate nostril breathing comes from yoga, and if you want to do it with me, Irene, we kind of create a phone with our hands, okay, so like an old-fashioned, like a mime phone, and with the thumb, you're going to close off the nostril that's on that side, and you're going to breathe through the one that's open. Sometimes it helps to blow your nose first. And then when you've inhaled through that side, you're going to close it off with the pinky and exhale through the other side, the side that's open. Good. Now keep your hands as they are and inhale. Close it off with the thumb and open it up and exhale. Keep your hands as they are and inhale. Close it off with your pinky and open it up and exhale. And inhale. Close it off and exhale. There you go. So 5 to 10 rounds of that, both sides, closing your eyes, doing, very intentional, slow breathing. What that does is balance the right and left hemisphere of the brain, and it is instantly effective. You will feel the benefit of that immediately. A Xanax takes about 20 to 30 minutes to kick in. This you can feel the effects of immediately. So I highly recommend that for anxiety.
Nice.
Okay, next slide. Okay, so you've tried the nostril breathing, you've tried, eating well, it's still not helping, and you really would like to talk to somebody. Great, good, you should. Seeing a therapist is something that healthy people do. It is a sign of strength, not a sign of weakness to seek out support. But I think managing expectations of what therapy can and can't do for people is really important, okay? So a therapist and if you are seeing a therapist who's giving you advice and telling you what to do, find a new therapist. Okay, it's not to say that we don't, with certain patients say, okay, I don't think that's a good idea. I mean, of course we have our opinions and we will share them, but we're not in the business of telling you how to live your life. We are there to walk alongside you and to objectively with our experience and with our knowledge, help guide you towards what you ultimately want for yourself, what you need to do for yourself, because you know yourself better than anybody. I am not an expert in Irene or in anybody, but I am an expert in mental health and in terms of understanding and addressing some of the behaviors and thinking that get in the way of people, you know, getting better or doing what they want to do. That is really where our role is. So we model healthy boundaries, we have resources and recommendations, we sit with people and just, you know, you will never hear a therapist say, well, at least fill in the blank, you know, at least you're not starving, at least you don't have, you know, this wrong with you, at least, you know, no, you're never going to hear that from a therapist. Pain is pain, and we are clinically trained to be able to sit with whatever is going on with somebody and normalize it and help people understand what that's about for them and how to get better. One of the jokes I always tell people, just to speak to that, convince people to change, that is something that no therapist or no medication can do. If you are coming to therapy and you have no interest in making changes, in, you know, taking suggestions, in really actively participating, therapy is really not a good idea. Irene, how many therapists does it take to change a light bulb?
I'm not sure. How many?
It only takes one, Irene, but the light bulb has to want to change.
Oh, I see what you did there. I see what you did there.
So if you're not ready to change, you're not ready for therapy. But if you are, and you're willing to put in the work of at least 5 to 10 sessions, it could be a very helpful thing to do. Okay, so on to the next slide. We're almost done. And this is where help is available. Okay, all of these are links, I think. We don't necessarily have to click on all of them, but I'm happy if you want to. Obviously, the FAU Counseling Center is free and available and should be utilized by everybody at FAU who needs it. Unfortunately, that means there may be a waiting list. And in that case, I've listed the Fox Center, which is in Boca Raton and is a community resource. And they are excellent in terms of providing affordable, very affordable therapy. And both the Counseling Center and the Fox Center offer group therapy, which is incredibly helpful, you know, and people often find that very intimidating initially, you know, the idea of joining a group of strangers and talking about what's going on with you. But I would encourage people to try it. It can be a very helpful in terms of, especially when people are struggling with situational, you know, issues. You know, maybe they've lost someone close to them, or they're just struggling academically, or they're having a hard time, or they're lonely. You know, these are things that a group therapy, group therapy can be incredibly helpful in addressing. Individual therapy would be, you know, maybe more severe mental health issues, or if someone has experienced severe trauma. You know, it's not to say that individual therapy is not as helpful as group, but I think people are again, there's that resistance of that social anxiety of being part of a group of people that you don't know, and it can be awkward, but it can also be amazing for people who've never tried it before. I would strongly urge people to join. And for you know, addiction issues and eating disorder issues, there are groups specific to those as well. So NAMI is the National Association of Mental Illness, and they are a resource around the country. We have a Palm Beach branch, and I would suggest NAMI to anyone who is struggling or knows someone who is struggling and wants to help them, especially family members of more severe mental illness, schizophrenia, bipolar disorder, major depression, you know, that's quite severe. NAMI has some excellent resources. Compass is for the LGBT community, that is in Lake Worth, and they're just a hub for the LGBT community. They offer counseling, HIV testing, support groups. They're amazing. Crisis text line is 741-741, and that is available 24/7 for you know, any kind of crisis someone may be experiencing. It's confidential, and they have an excellent service. And then Psychology Today would be my suggestion for anyone looking for a therapist. If you have United Insurance and you want to work on an eating disorder and you want to see somebody right now, most of us are doing telehealth exclusively, but let's say you want to see somebody who's not far from Jupiter campus. You know, you put that criteria into Psychology Today and you're going to find a therapist. And at that point, you kind of have to, unfortunately, make a phone call. So that's our next slide.
Nice.
So you found a therapist, you're ready to start therapy. Oh God, that means I have to make a phone call. Yeah, you probably do. You can also send an email, but this is the information that we need. You know, if someone calls me and gives me this information, it really helps me to know if I can help them, and if not, who I can refer them to. So we need to know your name. If you'd like to share your pronoun, that's always helpful. We need to know if you have insurance, and if you don't, you know, what you can afford. Your availability is really important for us to know. Are you only available on Monday mornings? Are you available only in the afternoons? And then, of course, do you want us to text you or email you? That kind of information is really important to know. The part where it says brief detail, this is critical because I can't tell you how many voicemails I've received that are like 3 minutes long and people get into their whole life story on a voicemail. I don't need that information. I will find that information out. Don't worry. But in terms of just leaving a voicemail or sending an email, we really just need to know I'm having trouble with anxiety, or I'm experiencing my eating disorder has come back, you know, and I'm struggling with that, you know. So very brief description is, we don't need you to get into detail. So Irene, you've been very kind and have offered to leave a voicemail, a hypothetical voicemail. So let's just say that you have been experiencing trouble with an increase in anxiety for about a month.
Okay.
Okay. All right. So I will be the voicemail message and you can listen for the beep. Okay. So hi, thank you for calling Natasha Watkinson. Please leave me a voicemail and I will get back to you soon. Beep.
Right. Hello. Hi. My name is Irene Gatimi, and my pronouns are she, her. I'm interested in an initial appointment. Do you have availability? I'm experiencing trouble with lots of anxiety. It's been going on for a month or so, and I'm getting very concerned. Do you take XYZ insurance type, or do you negotiate payment rates? I'm available Monday, Tuesday, Wednesday from like noon to 3. I'm not if you're not accepting clients, do you have suggestions for other providers? You can text or call me at this number, or my email is XYZ. Thank you.
Perfect. That was perfect. That was so good. So yes, a variation of that. Obviously, you doesn't have to follow the script, but that essentially is all we need to know. And that's really all you need to tell us. And that, again, that can be in an email or a voicemail, but that really helps. And then you should expect a call back unless someone is taking time away from their practice. Most of us really should be getting back to you within 24 hours. If you haven't heard back in 24 hours, you know, after the second day or so, try again. And if people aren't getting back to you, try someone else. You know, that's not, obviously they're not picking up their voicemails, and that's, you know, not somebody you probably want to work with. So definitely I would say try and create a list of about 4 or 5 therapists after you've done a search, or if someone's referred you to someone, call them to speak briefly on the phone with them. And at that point, get a sense of, does this feel like a good fit? You know, does this feel like this is someone that I would like to talk to? Just because maybe a friend referred you to someone they worked with doesn't mean that that's the right therapist for you. So much of why therapy is effective comes out of the therapeutic relationship. And it is a relationship, you know, long-term work with a therapist can be incredibly meaningful, and it is a very real relationship, albeit a professional therapeutic one. But if you don't like your therapist, if you don't feel like your therapist understands you and listens to you and pays attention to what you're talking about, you're not going to be successful in therapy. So find somebody else. You know, it's okay. You know, I'm not for everybody. That's fine, you know, and we understand that. And I think it's better to address that early on than to feel like you have to see the same therapist you've been seeing, even though it's not really feeling like it's working for you. I will say though, you know, this is that initial phone call, but if you are in therapy, if somebody is in therapy and they just don't feel like their therapist is listening to them, or that they're not getting what they want out of the experience, you have to let us know that. That's part of the work, is being able to communicate your needs. And so to be able to say, hey, I just feel like I'm not getting out something meaningful from this, or I felt like you weren't really listening to me in our last session. A therapist that's doing their job well will appreciate hearing that and will want to know that, so that they can improve, and change whatever they're doing to meet the needs of the patient.
Right.
All right. I believe that's really all we have. If there are any questions, I'm happy to answer them.
I'm gonna go ahead and stop sharing just to see if there's anything in the chat that I'm missing. All right, so it seems that there are no questions thus far. I wanted to say that I really appreciate you talking about the brief detail portion of when you're making that phone call, because I think there's sometimes people get really nervous because they're not really sure, like, how much should I share? How far
Right.
should I be going? And so I really liked that. But if there's no other questions, that's all right. That's fine. Thank you so much, Natasha, for speaking with us today. And thank you for everyone for being a part of this, listening in. We really loved having you.
Thank you so much. This was a pleasure, and I hope it's been helpful. And Irene, I know that you're involved in with your community, and you have my details. So please feel free to pass any questions or concerns anyone has on to me, and I'll happily answer questions or refer people to providers that may be more helpful to them.
Great. Thank you. Thank you so much.
Thank you. I really appreciated being with everybody, and I wish everybody well.
All right.
Thank you, Natasha.
Thank you.
Thank you. We really appreciate it.